Thank you everyone for joining us. This session will be recorded, so we better go through each presentation. My name is Julian Smith. I'm head of the Department of Surgery here at the School of Clinical Sciences, and I'm joined by hopefully three of our distinguished supervisors. Deb and Tony are with us. Dan may or may not join us. And two students, Joanne, who recently got her PhD. Is that correct, Jo?
I've handed it in.
Handed it in.
Finally, officially got there, but
some minor revisions. So she's pretty much home and hosed, hopefully, and Nicole, who is on the home stretch, you might say. And so Jo and Nicole will give you a brief rundown from a student's perspective. I'll just begin with a brief introduction to the Department of Surgery. I think for any student interested in research is that we can offer projects for honours, masters or doctorates in all the surgical specialties. Projects can be in the basic science domain, they can be clinically aligned or can be related to databases, public health, and some of the non-technical aspects of surgery. And Monash University has a stellar range of collaborative opportunities for student researchers in surgical disciplines, whether they be at Monash Medical Centre, the Hudson Institute, or any departments on the campus at Clayton. So there are countless opportunities. The best thing is to make inquiries through myself in the first instance, and then I can make the necessary introductions to researchers in all our surgical disciplines. So that's just a very brief introduction from me. I might now ask Deb to give a brief supervisor's perspective. Deb is a voice specialist, works very closely with our ear, nose and throat surgeons, and is currently supervising Nicole in her PhD. So take it away, Deb.
Thanks, Julian. I'll just share my screen because last time I didn't do a presentation, so I'll just do a quick one and just go back to there. Hi all. Oops, let's go back to the beginning. Yes, I am lucky enough to be the Clinical Research Director for the ENT department, and first just do a shout out for Julian and the Department of Surgery through Monash University for some excellent research that is well and truly been fostered and encouraged by Julian. And I'm really pleased that as a department, the ENT department has really grown in our role, both in postgraduate supervision, but also just general clinical research and papers that are coming out from within the department. So we're delighted to know that we're now the leading ENT department in the Asia Pacific for publications and for general research at a clinical level, which is our main focus. So primarily our research interests are clinical and translational in that focus, but there's increasing interest in also lab-based work within the head and neck cancer and rhinology, laryngology and otology areas. Primarily our main research interests are surgical and medical interventions, whether it be across that area. And I think particularly we have some really keen researchers within Associate Professor Joanne Rimmer and rhinology in particular. In laryngology, we have Dr. Paul Paddle and also now Associate Professor Catherine Sinclair, who's come back from the US. Head and neck cancer, we have Associate Professor Elizabeth Sixton. And again, as I mentioned, we've got a real interest, the new person, Catherine Sinclair, in thyroid surgery, particularly with a procedure that she does that's new to Australia, and she's championing the way. And we also have some, perhaps not as prolific at the moment, some research interest in otology. But in terms of our areas of interest as well, surgical functional outcomes are also a focus, with quality of life measures, developing scales, and the use of technology in patient monitoring for outcomes, and also some drug and technology trials that are often supported by external funders. We've looked at the moment, our research projects is about 24 interdepartmental research projects, a number of interdepartmental ones, some shared with neurology, respiratory, paediatrics, and anaesthetics. We're involved in other universities other than just Monash University, with 3 projects and multi-centre big trials, both internationally and a national one. I currently am supervising with Julian Nicole, who's going to talk to you soon, who's about to submit her PhD in the next few months. Ju Ko, who I co-supervised with the respiratory department. We had Supipi, who finished her BMed Sci last year. We have 3 other. We have Claire Stanley, Mustafa, and Kate, who are all started just their postgraduate studies with us this year. Excuse me. We've got some new proposed topics, and so I won't, tease you too much with this, but there's lots and lots of new ideas that we're dying for some postgrad or prospective students to be interested in adopting, because I'm going to fix my voice. We are really excited about, across the whole area of ENT and head and neck, about some great proposals. And I'm happy to provide those lists, of different topics, but just to excite you, there's some really great ones within the Cancer Forum, which is relatively new to our research endeavours, particularly, the area of looking at some slightly integrative medicine aspects too, level of immune-related vitamins and ions in relation to human papillomavirus, and etc. There's a few more there. I shouldn't have had my tea so quickly before this. Sorry. So we've got a number of new studies that have commenced over the last year to 2 years that are really exciting, and I think useful just to say that we would love to hear from anyone who may be interested in doing more research, because we have a great outcome in terms of, we feel that we have good finishes of projects, and our publication rate is really high, and the ENT consultants who I work with are really excited by prospective researchers, but also being supported because they're primarily clinicians who like to do research, so are always keen to be involved with that. But we also have a number of consultants and myself who have PhDs and are really interested in pushing the envelope of new trials and studies. So that's probably about all from me. Julian, anything else you can think of I need to say?
No, we might take questions at the end, Deb. Thank you very much for that. And thank you for everything you're doing in ENT.
My pleasure.
Now, I see Dan has joined us. Dan is an upper GI HPB, in particular surgeon, with a very keen interest in pancreatic disease and pancreatic carcinoma, and has done a lot of basic science research, and has a very significant tissue bank associated with pancreatic tumours. Dan is also supervising, or did supervise, Jo in her PhD. So Dan, would you like to say a few words from your perspective?
Thanks, Julian. I'm a bit like Deb the last time. I don't have a presentation, but I'd sort of echo some of what she has said. We, I think general surgery often lags a bit in research, but we've been trying to build that up over the last 10 years, and we sort of have a strong basic science focus, and we work very closely with the Hudson, and Jo was co-supervised by Brendan Jenkins at the Hudson, which works really well if you need to do basic science work. So we have been interested in pancreatic cancer and endoscopic ultrasound, which is something that I have an interest in, which is a sort of gastroenterology investigation, but it's sort of that nexus, between gastroenterology and surgery, where you can, I think, do some valuable research. So we've had a number of PhD students over the years and some honours students. We've got 2 new PhD students, hopefully starting next year. We're always, you know, looking on the lookout for more students, but obviously, you know, it's a big commitment and there's a lot of time involved, and so that's you know, always something to bear in mind. But we're certainly very interested in more students. I'm not sure, Julian, I could go on about specific projects, but one of the things we're doing is sequencing of pancreatic cancer, and my main sort of research aim is really to try and bring comprehensive molecular profiling into the sort of surgical space for patients with pancreatic and biliary tract cancer. So we're doing projects around that.
Excellent. Well, thank you for that, Dan. We might finally move on to Tony Goldschlager. Tony's a neurosurgeon at Monash Health and has had a long-standing interest in research and very experienced in student supervision. And Tony, would you like to say a few words from the neuro perspective?
Sure. I've got a little presentation. I'll just make sure it works. Can you see that?
Yep.
Okay, so thanks, Julian, and welcome everyone. So this is on behalf of the whole neurosurgery department. My specific interest is spine surgery and skull-based surgery. But we have a range of projects. Also, my colleague, Associate Professor Leon Lai, is very big on research in vascular neurosurgery, and he also works together with the radiology department. So there's quite a number of projects. But we've basically got 2 arms. We've got clinical research, which there's a skull-based, very big database now that we're collaborating with the Royal Melbourne Hospital, St Vincent's, Epworth and Cabrini and Monash. And as spine, we've got some randomized trials in spine. We've got outcome database, and we're also part of the International Metastatic Cancer Research Society, which is like an international multi-center trial. So we're the Australian arm of that. So we've got a lot of data and a lot of projects coming out of that. In fact, we've done about 15 papers in the last year in these areas. We've got some basic science research. So basically what we've done is we've looked at what we deal with every day and the current treatments, and then we've looked at little areas where we can augment spine surgery with new technology. We've partnered with different institutions around Australia, like in Queensland, Adelaide, New South Wales, and also with commercial companies like Mesoblast, a stem cell company, and some other companies as well. And we've done a lot of laboratory work, which was probably about 10 years ago. We finished that, but we've restarted doing some more now because we found some gaps that we can go back and fill. We've actually taken some of the laboratory work to preclinical work. So we've done quite a number of animal studies and probably about 10 or 15 publications in that. And then we managed to translate one of the projects into the first human stem cell trial. And then we did a phase 2 trial, which was 100 patients. And then we just finished a phase 3 trial, which was 400 patients. It was a multi-center trial. We were the Australian arm. And the data is positive, so it's been submitted to the FDA now. And we might actually translate what we started like 13 years ago into a treatment for patients, which is very exciting. That's really like what we've been working for. So it's been a lot of work, but a lot of luck as well. So this is just an example. You see some results like in the preclinical studies, MRI, histology, and then you see the results translated to humans, and they have favorable outcomes. This was the phase 2 trial data. And then it's really like a ongoing process. So you start something, a lot that you start doesn't get anywhere. Then some things get to the clinic, and then you find more questions and more holes, and you have to go back to square one. So it's a dynamic process. We've currently got 3 PhD students, 2 master's students, and an honours student. And I'm not sure if we've got much more room at the moment, but we always can find more projects.
Excellent. Thank you very much, Tony. If you could unshare your screen, and we'll now move to Joanne to give a little perspective on being a PhD student in surgery.
Yeah, sure. So my background is in clinical medicine. I actually came through the physician training pathway and did my advanced training in medical oncology, and then a year in the clinical trials unit as a fellow there, and then was looking to do some research, I guess, broadly sort of related to clinical and translational research in the cancer field, and just found a good fit under the umbrella of the Department of Surgery, working under Dan's supervision on a project looking at precision medicine in pancreatic cancer. So we've done a sort of range of projects throughout my PhD. As Dan mentioned, we've got a big tissue biobank that sort of links into a translational pipeline. We work closely with the Hudson Institute of Medical Research as well. So we've developed quite a big database now of patients with pancreatic cancer. We've performed transcriptome profiling on and looked at using that sort of genetic signature derived from RNA sequencing to improve the diagnostic accuracy of endoscopy for the diagnosis of pancreatic cancer, and also done some mutational testing, which is translated into a couple of clinical trials, one of a small targeted therapy study in a group of patients with a particular molecular subtype of pancreatic cancer. And out of that work, we've now gone forward with a prospective clinical trial, trying to recruit 150 patients over the next couple of years, doing upfront molecular profiling using these baseline diagnostic biopsies to see if we can implement better sort of targeted, more focused therapies for patients with pancreatic cancer, who generally have quite limited treatment options and unfortunately quite poor prognosis. And alongside that, I've also done a little bit of basic science research. So that's under Brendan Jenkins' supervision in the Cancer and Immune Signalling Lab at the Hudson Institute, who works very closely with Dan, and work with him has been focused on looking at some innate immune signalling pathways in pancreatic cancer, doing some basic lab work and cell cultures and animal models, but also using some of our clinical resources, our molecular profiling that we've done and patient biopsies from the biobank. So a bit of a mix of projects. Definitely, to Julian's original point, I've found that there's been a lot of flexibility under the umbrella of the Department of Surgery to guide my research to meet my particular interests in clinical and basic science. Yeah, would be happy to have a chat to any students who are interested in doing similar work, either during or after this session, if anyone's interested.
Excellent. Thank you so much, Jo. So there was a description of some basic science and interspersed with clinical activity. And Nicole will now talk about her work in ENT, which was fairly clinically focused. And please go ahead, Nicole.
So hello to you all. Thanks so much for having me. So yes, I'm Nicole Free, and I am a speech pathologist and a PhD candidate in the Department of Surgery. So I had been practicing as a speech pathologist for 13 years in the acute medical and in outpatient voice and laryngology settings, when I had the opportunity to begin some clinical research as a part of my role while I was working in New York City from 2013 to 2015. And when I returned to Melbourne, I was really inspired to formalise my research training and was looking for the right fit to commence my PhD as a clinical researcher. And although it may not have seemed the most obvious choice for an allied health professional, the Department of Surgery at Monash Health and University had been exactly what I was looking for. And my research is investigating benign vocal fold lesions, which are lumps and bumps that can form on the vocal folds in response to trauma. And this phonotrauma is usually the result of a person's vocal load, meaning how much and the way in which somebody uses their voice. And one of our key questions is investigating the impact of load and the impact of exercise on the voices of these patients, and if we can avoid the need for surgical removal of some of these lesions. So since commencing my postgraduate research at Monash, I've had some really wonderful opportunities to present my research within the Monash community and at conferences in Australia, overseas, and more recently virtually. The Translational Research Precinct has provided many rich opportunities to share our research and to develop skill in presenting and communicating scientific research to a range of listeners. The Student Showcase Symposium is one such example, and the 3-minute thesis competition, which runs throughout the university, is another, which for me was a really fabulous opportunity, and I was the lucky winner of the Monash Uni competition in 2018. So as mentioned, my PhD is now coming to an end. I'm in my final year, nearing completion and nearing thesis submission, and certainly, I'm so grateful for my experiences in the Department of Surgery and for the support, the supervision and the mentoring that I have received. And I feel really confident moving forward in my career as a researcher with the skills and knowledge that this opportunity has provided me with. So thanks very much.
Thanks very much, Nicole. And can I ask you to just reflect on one of your other achievements during this time, that of motherhood, and how you combined your research with childbearing, because that's obviously been a significant life event as well.
It sure has. Yes, I've taken 2 little breaks in my PhD journey for the birth of both of my children. And, you know, I cannot stress enough how truly flexible my journey has been through Monash and how supported I've felt in that journey. I've had periods of time where I've been doing my research part-time and then returned full-time and then had another break for my second baby. So certainly as a mother and having these times out of my research, I felt really supported by the Department of Surgery.
Excellent, Nicole. Thank you for those remarks. I'll just share my screen briefly. Just to show one slide. Hopefully it'll come up. There it is. Just to show that there are other activities within the Department of Surgery, in addition to what has been mentioned this evening. I mentioned at the outset about all the surgical specialties that we can offer research opportunities in. And this slide just shows a few other areas that include aspects of robotic and minimally invasive surgery in many specialties. To the far right, just gives an overview of the opportunities just related to plastic surgery. And we have a large plastic surgery department that's doing research in a variety of areas. We can also offer opportunities with our paediatric surgical colleagues. That work can be done in this department or in association with the Department of Paediatrics. Also the vascular surgeons, the orthopedic surgeons, and the ophthalmologists and breast surgeons, just to name a few. So projects can be offered for honours students, master's projects, particularly the Master of Surgery degree. And we have at least half a dozen aspiring or practicing surgeons who are doing a Master of Surgery degree. And then we have the PhD students, and you've heard from 2 of them this evening. So I might just stop sharing and talking there and ask if there are any questions that I can see. We've got Andre and Natalia with us. If either of you have any questions, please feel free to ask now or to email any of us. My email address is at the bottom of the slide, just julian.smith@monash.edu. And I'm sure my colleagues will be pleased to to take any email inquiries as well. So we're almost at time. If there are no questions, I thank you very much for your attendance. I'm really grateful to Jin and Gabby for organising the symposia, and to our supervisors and distinguished students for their contribution. So once again, thank you very much, and have a good evening.
Thank you.
Thanks, Julian.
Thanks, Julian. Get on that golf course when you can, hey?
Indeed. We'll catch up soon. See you later.
Bye
Thanks,
all.
Jen. Thanks, Gabby.
Dad, I'll send a message. He was gone. It's all right. Thank you. Thanks, Julian.